15 years ago with a physician that was just such a positive example of how this work can be done. Like many people with short hair, I used to wear big chunky earrings everywhere. It was sort of my signature look. And, but I wore them for too many years, and the holes in my earrings, in my ears started to drop and finally split all the way through. I would only tell this story with healthcare providers. And so I had to go get them surgically repaired. So I went to this wonderful woman, a plastic surgeon, and when I was on the table, she looked at my ears and she said, you know, and she was just very matter of fact and very warm. She said, you know, I commonly see this injury when people are in abusive relationships, and I'm wondering if somebody did this to you. Well, it hadn't happened. It was just my fashion statement. But, but had it been what had happened, she made it so easy for me to say yes, because she made me feel that there wasn't a stigma attached, that she commonly saw this, and that she wanted to know how it happened. So, of course, you're taking that further, not just asking when you see an injury, but asking everyone if something is happening to them at home, and even better through our focus groups today, saying, I talk to all of my patients about what they deserve in relationships. We saw that question scored so high today. Today, you're taking this work beyond this new provision for screening and counseling on domestic violence to what healthcare providers can do if they want to create a more comprehensive program. You see your vendors here today who can help you with that. And what you also see today is the importance of partnerships in this work. You don't have to go at this alone. I know how hard you all are working. I know that sometimes you feel very overwhelmed, whether you're in a federal agency or you're a healthcare provider or you're a domestic violence advocate in a local community. You feel very overwhelmed with the needs you see every day. But I suggest to you, and you know this, that when we do this and we get it right, this screening provision will make your job easier in the long run. If you're a healthcare provider, you will begin to understand those patients you see that it always bothered you because you knew you didn't have quite the full picture. You knew they missed appointments. You knew they were not compliant. You knew they didn't take medications. You knew that something was happening that you couldn't quite put your finger on that was affecting their care. And so once you ask the question and be prepared with resources, that picture will come together. And for domestic violence advocates who often feel just so alone on the front lines of this issue with the overwhelming needs you face every day, you will have new partners to help in your efforts to reduce domestic violence and help victims get to safety. You know, this focus today is a part of an administration-wide commitment to reducing violence against women, ending violence against women. 3 years ago, President Obama announced unprecedented coordination across the federal government to respond to and prevent violence against women. Earlier this year, the President directed federal agencies to develop new policies to assist victims of domestic violence among the federal workforce. And in June, and some of you have seen this, President Obama and Vice President Biden were featured with star athletes in a new public service announcement called the One Is Too Many campaign, aimed at getting men involved in reducing dating violence. If you're a sports fan, you've seen it because it played all summer on ESPN and Major League Baseball channel and the NFL channel. I can't tell you how many guys have stopped me in the halls of the White House and the halls of federal buildings and out in the community and said how great it was when they heard that public service announcement, because it starts with President Obama saying, hey everybody, listen up. And it ends with Vice President Biden saying, even one is too many. You can see this, if you haven't seen it yet, on our website, which is www.whitehouse.gov/1 is 1 is too many. Use it as a teaching tool in your communities. This month, at the beginning of this month, President Obama issued his 4th proclamation for Domestic Violence Awareness Month. And I want to read you something that he said, that he wrote in this proclamation. While government must do its part, all Americans can play a role in ending domestic violence. Each of us can promote healthy relationships, speak out when we see injustice in our communities, stand with survivors we know, change attitudes that perpetuate the cycle of abuse. We must also ensure that survivors of domestic violence know that they are not alone and that there are resources available to help them. So I want to thank all of you for answering the call and for doing your part. Thank you so much.